whenever I'll come back to my family home for a vacation, I would often find my dad very busy with his 50-bedded hospital. I noticed that even though he is very busy treating all the patients, still there is a lot of business process which can be improved within the hospital, and I'll always have those discussions with him. And then increasingly, those discussions became more and more, stronger. Until one fine day when he said that, hey, I'm a doctor, let me do my job. If you think you can do anything better, why don't you do it yourself? And that kind of triggered something in me, and I started doing more research about the healthcare in India. What I figured was that even though the science of healthcare, the doctors are getting better and better by the day, the new age diseases, which like diabetes and hypertension, now a lot more care was required outside the hospital than within the hospital. And how I summarize that is that today's healthcare system is a reactive and fragmented. When I say reactive, it means that people go and seek care only when they have symptoms. And when I say fragmented, then I say there is hardly any discussion, any connect after the patient leaves the clinics or the hospital. There is a lot of disconnect between just one annual health checkup and what happens after that. There I realized that there is definitely a big room to actually address this as a problem. For that reason, I joined Indian School of Business in Hyderabad to study healthcare management. We as a team looked upon an HALT prize, and HALT prize challenge that year was how do you solve the problem of non-communicable diseases, especially for focusing on urban poor. And we figured that the only way to solve that problem is to make the health system more proactive, coordinated and continuous. If we don't do any of these together, then you just can't solve this huge problem of non-communicable diseases, which is the reason for one death every 12 seconds in India just by heart attack, which is the reason for maximum number of people falling under the poverty line within India. And the problem is pretty much similar across the globe. After 3 to 4 years of working in this area, we figured that there has to be a combination of technology and human touch to actually address this problem. Now, it all starts with a simple screening, and based on that, the system recommends that what should be your next step. Now, even though the system recommends, but the human touch, which is the health coaches or health workers, are very, very integral piece of the solution, which ensures that the next step is actually followed, the compliance, the adherence is high. And once they meet the doctor or cardiologist or endocrinologist or the specialist, then it's again the next step is that our periodic monitoring is done again by the health coaches to ensure that the continuity of care is there. This solution can be utilized in multiple environments. Now, this at first by the large NGOs and governments who wants to make a real difference in the life of the very poor people. Now, there has been a lot of, for decades we have been doing annual screenings by the government, by the corporates. What happens after that? Do we really know that? In one of the recent screening program that we did, we found out that of all the people who were identified to be at high risk, only 11% of them went to and saw the doctor. 89% of them didn't even bother and go to the doctor. Now imagine what will happen to that 89% of that. And what was the impact of the screening that we did? I mean, very limited, right? So the only, and if you can help the people ensure that there is a care continuum, and that is what we have been able to show in a scalable manner. The other thing for corporates, also the problem is very similar. What happens after the annual health checkup? The employee engagement is very, very poor. At first, very 20 to 30% of the people actually come for annual health checkup. Now within that also, there are very few people actually go ahead and visit a doctor after that and ensure that the continuum of care is maintained. And that's where we have been able to show the impact of the model, that through a good disease management process, the right technology, the right and trained health coach, the doctor, we have been able to impact not only the health of the entire organization but also the claims. So we have been able to show that our solution, when implemented in full with the support of the leadership, can actually reduce the claims. And last and but not the least, the solution can be implemented to the clinics and hospitals, where the patient engagement is more and more important for them, not only to improve the health outcomes but also to ensure that the revenues are continuous and not only one time when the patient visits the clinic or the hospital. And so we are operating in 3 different business segments with the same core solution, which improves care continuity, which ensures that the care is not fragmented and it's coordinated, and in some it ensures that there are more engagement, the health outcomes are improves, and at the same time there's more services being utilized as well. So effectively win-win for everyone. Thank you.